Hello, my name is Nadine Vogt, and I'm currently a third-year vet student at the Ontario Veterinary College. And this past summer I had the opportunity to work with Dr. Yu, Dr. Weiss, Dr. Pai, as well as with Joyce Rousseau on a project regarding the identification and susceptibility testing of canine and feline otic Malassezia species. So let's start off with some background information first. Malassezia is a genus of fungi or yeast which includes 14 recognized species. Malassezia pachydermatis is a commensal organism of cats and dogs, and it's an opportunistic pathogen that is implicated in otitis externa. Otitis externa is defined as inflammation of the external ear canal, and it is a common problem representing anywhere from 10 to 30% of presenting complaints in general practice. So here's a dog's ear showing the characteristic brown exudate associated with Malassezia otitis. You can see the ear is very inflamed and the skin is also thickened. Similar clinical signs are also seen in cats. Otitis externa is often a chronic and recurring problem, and in severe cases, surgical excision of the external ear canal is required, which of course is a very invasive and expensive procedure. So as an opportunistic pathogen, Malassezia is rarely a primary cause of inflammation, but rather it causes problems when epidermal barriers have been disrupted for some other reason, such as food allergies. So here's an image of Malassezia that has been stained and viewed with a microscope. You can see the characteristic bottle-shaped organisms that stain very basophilic. So what set the scene for this research was that recently, multiple cases of Malassezia otitis and dermatitis have been reported as non-responsive to conventional treatments of antifungals that have been used to successfully treat similar cases of Malassezia otitis and dermatitis. However, we should also consider that the current standard of susceptibility testing uses systemic concentrations of drug. Meanwhile, topical therapy, which is used to treat otitis, can reach concentrations of anywhere from 10 to 1,000 times that of systemic treatments. And this is also complicated by the fact that there is no standardized method of testing Malassezia species for susceptibility. So our objectives for this research were firstly to isolate Malassezia species from cats and dogs with and without otitis externa at the Ontario Veterinary College, and then to speciate those isolates using PCR, and finally, to determine the minimum inhibitory concentration of Malassezia species against antifungal agents contained within topical ear medications. So in terms of methods, we began by collecting oral swabs from 51 dogs and 7 cats. Those samples were then cultured on modified Dixon's agar for 3 to 7 days at 32 degrees Celsius, and isolates were stored in cryostore vials at -80 degrees. The isolates were then subcultured on modified Dixon's agar for 5 days at 32 degrees Celsius for subsequent use in PCR. DNA was then extracted using Instagene matrix following the manufacturer's instructions. And PCR was used to amplify DNA at a segment of the 26S rRNA gene. Sequences were evaluated and cleaned, and species were assigned using the basic local alignment search tool. Minimum inhibitory concentrations of clotrimazole, miconazole, nystatin, thiabendazole, and sulfur sulfadiazine were assessed using a broth microdilution method. So for the broth microdilution methods, twofold dilutions were performed in a 96-well microtiter plate. Modified Christensen's broth, yeast suspensions, and antifungals were added at test concentrations ranging from 1 microgram per mil to 256 micrograms per mil. Suspected Malassezia was isolated from 37 of 58 animals, including 35 dogs and 2 cats. Of those samples, only 4 were unaffected dogs. 26 samples were successfully amplified with PCR, and 25 of those were identified as Malassezia pachydermatis. The remaining sample is currently being sequenced. Based on the sequences from the 26S rRNA gene, 3 main phylotypes were identified. And based on preliminary work, there was no obvious relationship between phylotype and severity of clinical disease. This result awaits confirmation with pending susceptibility testing results. So it is unlikely that similar 26S rRNA sequences resulted from sample contamination, because there was a time delay in collection and isolation between different samples. The identity of all samples as Malassezia pachydermatis is consistent with the literature. The species is widely reported as the predominant yeast organism in dogs, ranging from 56 right up to 97.6%, depending on such factors as geographic location and sample population. Regardless of culture morphology and disease state, Malassezia pachydermatis is the predominant yeast organism in dogs. Future work will include speciation and susceptibility testing of otic yeast populations in cats. I would like to thank Drs. Yu, Weiss, and Pai, and especially Joyce Rousseau for her technical assistance. This project was funded by OVC Pet Trust and Bayer. Thank you for listening.